Good afternoon, and thank you for joining us today. My name is Tina Tebow, and I'm the Director of Media Relations for the Province of Nova Scotia. I will be your moderator for this afternoon's news conference. Joining us today, the Honourable Stephen McNeil, Premier of Nova Scotia, the Honourable Randy Delory, Minister of Health, Province of Nova Scotia, Dr. Robert Strang, Chief Medical Officer of Health, the Nova Scotia Department of Health and Wellness, and Dr. Gaynor Watson-Creed, Deputy Chief Medical Officer of Health. Please note that this news conference is being live streamed. Both Premier McNeil, Dr. Strang, and Minister Delory will have a few words to say before we begin the question and answer portion of this news conference. The question and answer portion is for media only. I now invite the Premier to say a few words before we
Thank you and welcome. As you know, we now have our first 3 presumptive cases of COVID-19 here in Nova Scotia. And first of all, my thoughts are with those individuals, and I want to wish them a speedy and thorough recovery. We've also taken additional measures based on this, and I'll have more to say about those later. But first of all, I'd like to have Dr. Strang talk to you about the 3 presumptive cases.
Thank you, Premier. Good afternoon, everybody. So we've had 3 cases in the last 24 hours reported from our lab, and we now have the capacity in the lab to be able to report presumptive cases tested here locally. They are all these positives are going to the national lab for confirmation. We have a 61-year-old woman who lives in Kings County who is traveling to Australia. A 50-year-old male who lives in HRM was traveling to the USA. And a 30-year a male in their 30s traveling extensively throughout Europe. So all of these cases have had travel outside of the country, which would have been their source of exposure. None of the 3 cases are connected to each other. Extensive public health follow-up on all of the cases and their close contacts began last night. As soon as we were notified of the cases, we were able to say that there are a small number of Nova Scotians who were in close contact with these individuals, and all those, but we're fortunately a small number, all those individuals are now being asked to quarantine themselves for 14 days and monitor their symptoms carefully, and then call 811 if they develop symptoms suggestive of COVID. So the public health steps are well in place to manage these 3 cases.
Thank you, Dr. Strang. Minister Delory.
And thank you. And in light of this, I know Nova Scotians want to know not just the works and the steps that we're doing as government, but also our partners at the Nova Scotia Health Authority. So I think it's important in this ever-evolving stage to recognize that the Nova Scotia Health Authority is taking steps to ensure that they build capacity now that we have presumptive cases here in Nova Scotia. What this means is they'll be taking steps to wind down services like education programs and face-to-face clinics to really focus their resources on urgent and emergency care services as they continue to, again, ensure that they have the capacity they need to respond to increased demand in our hospital system. And it's important in that regard for Nova Scotians, again, not just for the COVID symptoms and assessments, but for all of their health, to ensure that they monitor and go to hospitals and make use of hospital resources really when they deem it necessary.
We'll go back to Dr. Strang first and then to the Premier. Go ahead, Dr. Strang.
I think it's you first.
Yeah, I'll say a few words, then we'll go to Dr. Strang. So, Minister, thank you as well. We are continuing to work under the authority of the Health Protection Act that was instituted and to institute the following measures. Last week, we announced the public sector employees, including healthcare workers, teachers, and civil servants, along with students and children in daycare who traveled outside of Canada, are required to self-isolate for 14 days when they get back. And we encourage the private sector to do the same, and I want to thank all those in the private sector who put that message out through their organizations. But now we need to go further. Anyone who travels outside of Canada, regardless of where they work, must isolate for 14 days upon return. There are screens up the Halifax International Airport to tell people who return to Nova Scotia that they must isolate for 14 days and where to go for information if they feel sick. We're also working with our federal partners who are responsible for border security to beef up that screening process. In addition to the work they are doing, we are also placing our own inspectors at the airport, whether you are arriving domestically or internationally, to remind everyone to self-isolate and let them know what to do if they are feeling sick. We're expecting a lot of snowbirds to return to our province in the coming days. It will require all Nova Scotians to remind their loved ones they need to self-isolate for 14 days, and if they are feeling ill, to follow the public health advice. That's why we're also announcing today that schools and daycare centers will remain closed after March break for at least 2 weeks, and we will continue to review in consultation with public health. March break camps are canceled. We're also closing all long-term care facilities to the public. Visitors will not be allowed in until further notice. The casinos in Halifax and Sydney will close tonight at midnight, and bar owners will no longer be allowed to operate their VLTs. We have told our public service anyone who can work from home should work from home, effective immediately. Tourism Nova Scotia has announced that its employees must work from home and its visitors information centers will remain closed indefinitely. Seasonal employees who work for Tourism Nova Scotia and government can rest assured our organizations will work with you so that you not go without during this time. And I also want to thank the bar and restaurant owners who have been observing the advice we issued on Friday of not having gatherings of more than 150 people. Going forward, restaurants and bars are asked to practice social distancing of 2 meters or 6 feet. If that means moving tables or seating, do so. For all of us, it is important to continue to follow the proper hygiene practices, monitor how we are feeling, and follow the screening protocols that is available on 811. We all have to do our part to reduce the spread and keep Nova Scotians healthy and safe. Take care of one another, be kind to one another, and ensure that we support those in our province who require our support. Dr. Strang?
Thank you, Premier. So I can't emphasize enough the importance of us all working together to make sure these measures, some of which are directive, some of which we're requesting. But it's critically important at this time. We have a bit of a luxury in Nova Scotia. We're the last province to identify cases, and Atlantic Canada has not seen the level of spread we're seeing in Ontario, Quebec, and further west. We have a chance to get out front of this. It'll be the combined impact of everybody adhering to the personal protective measures, careful hand washing, being careful where your hands go, in making sure where we can, cleaning these what we call the high touch surfaces, avoiding touching your face, especially with unwashed hands, staying home if you're feeling unwell in any way. All of those are going to be critically important to minimize the spread of this virus. Appropriate use of masks is also, both for healthcare workers and for the public, is also part of that. The other public health measures, which we announced on Friday and as the Premier's outlined, are strengthening today. They are also critically important. Keeping us away from each other minimizes the chance of spread. And if we do have somebody who is actually infectious, reduces the number of people they're potentially exposing. This is all about us doing what we need to do collectively. I fully appreciate that this is a huge change for people, huge change in our communities, creates significant burdens on organizations, on families. But people and families and organizations are already stepping up to the plate, as the Premier have said. If we all collectively work at this, what we will do, we will substantively slow down the spread of COVID-19 in Nova Scotia, reduce the size of a peak when we get to a peak. That means that there are fewer people that will become sick, fewer seniors or people with underlying chronic diseases that will become critically ill, It's about protecting those people, but it also means that we can continue to run the healthcare system to the best of our ability, and all of us may need that healthcare system at some point in time. So this is a time for all of us to work together to approach this not in fear, but approach in a sense of caring and community.
Any questions?
Sir, could you repeat again the ages of people involved?
I can repeat them again. There's a woman in her 60s, a man in his 50s, and a man in his 30s. The woman is in Kings County. The two males are in HRM.
Has contact tracing been completed for these 3 presumptive cases? Are you confident that that's been?
So when we start contact tracing, we certainly initially, a significant amount of contact work was done over last night. But as you can appreciate, as we continue to work with those individuals and their families, there may be further contacts are identified. But significant work was done yesterday evening and last night.
How are they feeling right now, those 3 people?
Do you want to comment on that, Gaynor? You've been.
All 3 cases, I'm happy to report, are managing their symptoms at home and recovering from there.
And how are their families, if they have families?
Yeah, so for the most part, their families are in good health and in good spirits, and we're continuing to get more information on family members.
Can you speak to the availability of tests and what the capacity is moving forward?
So we're working the best we can across the country. The access to laboratory testing, both in terms of the specimens that are the swabs that are available, as well as the ability of how many tests that can actually be done through the sophisticated machinery that actually does the testing. There is a finite capacity there.
Is that number in Nova Scotia now?
We're able to do upwards of 200 tests a day. Now we can rely on our local tests. The turnaround time is much less, so we'll be able to continue to push through more tests. It's something that we continue to work closely with our lab colleagues on, and how do we make sure we have the maximum capacity.
So you don't have an outside number for that, for what you can do locally?
We don't have today. I mean, our lab colleagues are continuing to refine their techniques. So one thing we've looked at is we're changing the type of swab that they use. But what they need to do is, within the lab, do some comparative testing between the 2 swabs and to make sure that the alternative swab, which we have a much greater supply of, is actually adequate.
I have the same question about ventilators. How many are around the province? What's the capacity? When does it get overwhelmed?
So there's approximately 240 ventilators in the province today, and there's another 140 that we've ordered through the national procurement process that is there.
And I imagine some number of those are for non-COVID cases.
I think the health authority who operate and the health professionals on the front line, they manage the health system resources based upon the needs of the population that they're serving at the time. So that may vary on case by case.
With the influx of people returning to Nova Scotia, many are asking why there aren't assessment and screening measures in place at the airport. They're saying that that's not enough right now to get off the plane and be directed.
Yeah, so Canadian border agencies across the country has been dealing with that. So we heard the call from people who came in here. That's why we've stepped up the protocols ourselves. So in addition to what Canadian Border Agency Service will be doing when someone comes in on an international flight, we will also have our own inspectors there to provide support and identify issues and direct people in the right place and tell all of them about the isolation and where they can go if required medical treatment. On the flip side, because of the actual restrictions on international flights now that are going to be coming into a few airports, Montreal and Toronto, we also have to worry about the domestic travel now because people will be landing in Montreal, Toronto. They may be, they'll be screened in those airports, but they need to understand that when they come home, what the restrictions are on them here and what are the places that they can go to receive that support. So as of tomorrow morning, we will have our own people as well inside of the airport to greet our fellow Nova Scotians when they return.
We've heard non-essential travel outside of Canada not recommended. Is it time to stop moving within Canada?
I think I'll let Dr. Strang answer that.
So we may get there. We're not there yet. We still, even though we're seeing increasing activity in several provinces, and now every province has some activity, it's something at the tables that Dr. Watson-Creed and I sit at is a very active topic of conversation. Everything we do is all about appropriate balance, knowing that all of our interventions actually have a significant impacts. So it's really important that we work through those impacts and what the potential benefits are, and when is the right time when the balance of benefits actually outweigh some of the potential negative impacts. We're not that yet there in Canada. We may well get there in the coming days or weeks that we actually start to close down travel within Canada. But it still goes with the key message is that if people really don't need to travel, even within Nova Scotia, now is the time to start thinking about how we actually stay within our communities, within our families, minimizing our interactions with others, all about, so we, as I said earlier, protecting each other and protecting the resources we have to provide health care when necessary.
Is it necessary for this frenzy at the grocery stores to be stockpiling goods, in your opinion?
No, I think that the mass stockpiling, first of all, this is about community. So how do we actually, what we have, how do we make sure everybody has some of what they need? But it also feeds into the fear and panic. So I would encourage people to work together. But this mass stockpiling for one individual or one family is not helpful at all.
I just want to echo my support to that. I think we've seen, sorry Keith, but we've seen that when in some communities shelves are of certain products are being taken up by, unreasonably by a small group of people. We need to be mindful that you'll be isolated for a couple of weeks, not 6 months. And you need to make sure that all of us have access to the products that we required if we would be isolated. So I think people need to be thoughtful about looking forward to what does 2 weeks supply look like for them, and make sure that they think of their other fellow citizens who will require some of that as well. Keith?
So, Dr. Strang, I just wanted to make two things actually. Just wanted to clarify, we are no longer sending tests to Winnipeg for confirmation, or
No, they still have to be sent to Winnipeg for the final confirmation, but we've now done the validation that we can actually stand behind a positive test in Nova Scotia, and that's why we're saying today publicly these are presumptive, but they have the final confirmation at the national lab. That's the same that every province and territory is doing.
All right. And is there an emerging threat now from people who aren't showing symptoms but are carriers? Can you address that in any way?
So overall, we're still seeing that the vast majority of this illness is transmitted by people who are symptomatic. There may be some level of asymptomatic transmission, but in their assessment globally, the World Health Organization continues to repeat that's not a major contribution to the spread of this disease. So that's why we focus on people who have the appropriate travel, and that changes all the time, and a set of symptoms.
I think important, if I don't mind, before, I just want to add support to this. If you feel you've had any of those symptoms, go to 811. I think oftentimes it's been part of our human nature. If we have a cold or feeling something, we go to work. We just continue. This is not the time to do that. This is the time to reach out, go to public health, go to the health department, and verify whether or not you have COVID-19. This is critical. We know those that are very sick. Those of us that are maybe carrying this who may not be feeling well, go and find out for sure. This is absolutely critical for us to be able to control the spread of this inside of our province. It's exactly what Dr. Strang has been saying, and we need to make sure we continue on that vigilance. Let's stay focused, and particularly those who are returning from down south. If you have any symptoms of that, any kind, isolate yourself and then call 811.
And just to pick up on that notion of symptomatic versus asymptomatic or non-symptomatic situation, I know Dr. Watson-Creed, I asked earlier today questions about some people who want to be tested before they're symptomatic. And perhaps you can explain why that is not a recommendation that Nova Scotians who may be calling 811 when they don't have symptoms and or are looking to get tested for COVID-19 before they're symptomatic. Again, perhaps you can explain.
Yeah, so the key to this will be finding people when they are actually symptomatic, because that is when the test is at its highest validity. So that's when people are what we are doing what we call shedding the virus, meaning that we can actually pick up the virus with the test at that point. point and confirm whether or not they have it. Prior to being symptomatic, we can't do that, and so they may have a negative test, but that doesn't mean that they won't still develop symptoms over time and therefore change to a positive test. So the real key is for people to be aware of what their symptoms are and look to 811 to guide them towards assessment at that point. It's one of the reasons that, for example, that we haven't stood up mass screening at airports across the country as opposed to giving people information at airports, because when they come off the plane, they may not yet be symptomatic, and so that's not necessarily the time to screen them. The time to screen them may be 2 or 3 days down the road when they actually develop symptoms, for example. And that's just the nature of testing for viral diseases.
And those symptoms, just as a reminder again, are the temperature above 38 degrees Celsius, as well as the development of a new cough, I think are the two predominant symptoms to be monitoring for.
We'll take a few more questions before we go to the phone. Go ahead. Go ahead, Dr. Strang.
I just want to remind people that 811, go to their website. They have a wonderful assessment tool. So whoever can, that's the first step. Go to 811, go to their online assessment tool, and then if you screen in from the assessment tool, then you can actually call 811. But there's a lot of this people can do without having to reach out to the healthcare system.
Can you talk about
the social distancing, minimizing interactions? You talked about domestic travel. There's a lot of information flying here. I just want to make sure I got this right. Are you calling to consider minimizing domestic travel now, or are you calling to examine that further down the road? What's the timeline when it comes to, say, not flying inside the country for Nova Scotia?
So there's no firm timeline. What I say, as collectively, as Gaynor and I, as we talk with our colleagues, we're not there yet where we have to become more, I guess, restrictive of interprovincial travel. What I'm saying now, even travel within the province, if really ask yourself, is this something I need to do? We need to start getting in the habit in this event is, do I need to be out and about, whether it's flying to Vancouver, whether it's going from Halifax to Truro, or whether it's just going out, meeting my neighbor around the block. Now's the time for us to think about how do we actually help each other from getting sick by distancing ourselves. Some of that may be, if you have to be with people, avoiding close face-to-face contact, but it's not just possible. It's now a time to say, how do we actually stop getting together and not having essential travel, no matter what the geographic scope of that travel is.
Shana, go ahead.
Talk about, thank you. Can you talk about the timeline for the confirmation? So when did the patients call 811? When did the QE2 lab find the positive test? And when do you expect to get confirmation from the national lab?
So I believe there was 1 or 2 calls on Thursday. Another one was on Friday. We were getting calls and Dr. Watson-Creed and myself calls and texts from the lab late yesterday afternoon, and then we all swung into action. I don't know what the timeline is from the National Lab. It depends on whether they got on the flight out last night or this morning. But once they get the National Lab, it's about a 12 to 18-hour turnaround time, a message by call or text to our lab, and then they notify us.
Expecting to know on Monday at the latest.
I would expect it's possible today, but most likely Monday we'll get the confirmatory reports. But I want to repeat that we have enough experience now with our own laboratory that we are very comfortable that what tests positive here is a true positive.
When they arrived in the country?
Yeah, it varied for each one. I think for the majority of them, for all of them actually, it was within the past week. Let me just see if I have the details on that. So one arrived on the 13th of March. One arrived on the 10th of March, and the other arrived on, sorry, I'll see if I can get that, on the 8th of March.
So rather than the date, I want to emphasize that through our contact follow-up, where we've focused very carefully on the person who's sick and really working with them, trace their footsteps, where they have been since they have come back to the province, when they became symptomatic, and especially where they went once they became symptomatic, because that's critically important. That through that we identify who's been in close contact. And fortunately, in these 3 cases, they've had a small set of close contacts.
We're going to go to the phone lines now. We have time for 3 questions from the phone. Do you have a question for one of our panel members from the phones?
I would.
Okay.
May I ask, can you tell us where where the 3 people came from, which countries they returned from?
Sure. As I said that earlier, one was from Australia, one traveled in the U.S., and one in Europe.
Could I ask a question?
Go ahead. Yep.
I'm just wondering, what if people will not follow the self-isolation? I know in Bridgewater, somebody knowingly went into the nursing home, knowing that they were had just traveled abroad, and they just said, "I'm doing it anyway." Is there going to be measures taken to ensure that people are following this protocol?
So the case you talk about, that's one of the reasons why we're closing down long-term care facilities to visitors. We need to protect our most vulnerable seniors and limit their interaction with the outside world for the time being. I really appeal to, we are, of all Nova Scotians, this is a time not to think about ourselves, but a time to think more about each other. So I really appeal that people who are being told or asked to self-isolate, they need to adhere that. And as communities, we need to support people. So if people are self-isolated and they need help to get groceries or their prescriptions, we need to step up as communities and work together to protect each other.
We'll go to the phone line for one more question from the phones. Go ahead.
Today.
Go ahead.
The northern part of the Dolomite ski region in Italy has been a real hot zone for infection for this virus. There were a number of people reported in Great Britain who returned from a ski trip. There, 17 out of 23 tested positive. There have been 3 individuals from Shelburne County who were in the same location, returned here, and one of those individuals have told his work colleagues that Nova Scotia Health Authority told him he did not have to self-isolate. My reading of Health Canada and the Nova Scotia directives is that people must self-isolate when coming from Italy. Is that true?
That's absolutely correct, and they're given that information when they come back internationally, and certainly from Italy, their contact information is obtained by Canada Border Services Agency. That is passed through my office to local public health, and then we reach out and make contact with those travelers. So those individuals should be well aware of their need to self-isolate. I think this question came up on Friday. If there are specific details about specific circumstances, they need to be brought to local public health, and then we will look into those individually. But we need specific information.
That's all the time we have from the phones. We'll come back to the room for 2 more questions. Go ahead.
Just in terms of schools being suspended for 14 days, what's the contingency plan here? A message to parents, is there going to be an assessment period? Will there be more information at a certain time?
So the reason we're announcing this today, obviously, is to give parents an opportunity to look for childcare in the coming weeks. But my message to them is, if we do not feel comfortable with opening schools, this will be extended. Our number one priority will be the public safety and the health safety of Nova Scotians and their children. One of the things that I said earlier, daycares actually will be open tomorrow, and they'll be closed on Tuesday. It will not be after March break. They will be closed on Tuesday. So parents will need to look for alternative opportunities for childcare.
Can you give an update on the 811 situation? So there were lots of waiting times. How is it now? Is it better, or?
Yeah, so they continue to work, and I think many provinces are suffering the same challenge when leveraging the telehealth system for triaging the front end. So we just continue to work with our partners that manage the 811 infrastructure, adding the telephone line so that people can get into the system, and hiring the people and bringing the staff in to to ensure they can get back to them in the most timely way possible. But as we mentioned on Friday, and as Dr. Strang mentioned again today, there is an online form that provides kind of the key questions to ask that even triggers whether you should be calling 811 or not about the COVID in the first place. When we first announced that we were finding people were calling just to ask general questions, if you read that information online, there is a separate phone number if you have general inquiries about COVID-19 and the situation, or travel advisors or so on. The federal government has a number of resources they're linked to from those sites. So first go to the 811 website and work from there before you even pick up the phone to make the call.
We'll take one last question.
We're seeing retail stores cutting back on their hours and reducing the time that those workers can work. So I'm wondering if there are any kind of supports that the province can offer to those people.
Well, the Prime Minister was very clear that no Canadian would go without and be punished by this virus. We are currently right now looking, Minister McClellan and his Department of Business is looking at how do we dovetail into those national programs, not only for individuals but for business owners and businesses to come through the economic challenge that'll be before us. But first and foremost, we're talking about public safety and health right now with a focus, and the Minister will have some announcements this week in dovetailing on what the Prime Minister talked about. I think it was a $10 billion stimulus package that'll be there. We're working our way through with them to find out what does that look like for us, and then some of our own programs and our external partners, small business loans that we have and others, to see what's the best way to support them.
Should we be 6 feet apart from each other?
We're pretty close. But I will say this, I'll let you answer that question.
So, good point, but we're also not in face-to-face contact either, because it's not so much this, it's the face in front of us that actually is the issue. But your point well taken.
Thank you very much for joining us today.
Before we go, I do want to say this. I want to recognize Gary Burrows here, the leader of the Democratic Party. Gary, thanks for continuing to put out messages. And I want to say this, and this is not at Gary, I just wanted to acknowledge Gary being here. This is a message to all of the leaders out there who have responsibility to lead different organizations, whether it's a political party or a union organization or a group of workers. Everyone competing for airtime is not helpful. Everyone thinking they have the right idea is not helpful. We need to rely on public health. The decisions that we're making today are not based on something that that I dreamt up overnight. These are working with public health, looking at best practices across communities to make sure that we provide the support. So there's a lot of talk about the N95 masks. We have unions telling workers they need that. The World Health Organization has said no. People who understand this disease is going to cross. We heard last week when Dr. Gaynor Watson spoke about the very exact thing. That's not helpful to send confusion amongst our employees. This should be a time when Nova Scotians stand behind one another, and a time when we let the science speak for itself and best evidence and best practices speak for itself. I encourage everyone, whether you lead a political party or whether you lead an organization that represents workers across this province, speak to public health. We've had people talking about closing schools now for weeks, haven't spoke to public health. While I respect their ability to deliver education, let's talk about public health. While I respect people's ability to represent their employees, let's rely on evidence when it comes to the decisions they're making. Nova Scotians require us to be at our best right now. Thank you all.